It's 8 a.m. from Fox 35. This is Good Day Orlando.
Are you having trouble getting pregnant? How the founder of Facebook is sparking a conversation about the obstacles of starting a family.
Still to come, Facebook founder Mark Zuckerberg and his wife started a big conversation with their baby announcement.
The couple revealed that not only are they expecting, but that they also struggled through 3 miscarriages to get where they are now. So, just how common are miscarriages? Can they be prevented? We're going to talk more about it with a local fertility specialist. That's coming up right after this. It is 8:21 right now. You're watching Good Day Orlando. Welcome back on the Health Watch. Over the past week, Facebook founder Mark Zuckerberg announcing that he and his wife are expecting. The shocking news to many was that his wife, Priscilla, has already had 3 miscarriages. And that news, of course, has a lot of women talking. And many happy that the Zuckerbergs are being open about this topic. And joining us this morning is Dr. Mark Trolice with Fertility C.A.R.E. He is a fertility specialist. Great to see you. Thanks for coming in.
All the time.
Let's talk first about miscarriages, because I think there is a lot of women out there believe I've done something wrong when a miscarriage happens. How does a miscarriage happen?
Well, most of the time with miscarriages, more than 2/3 of the time, it's a chromosomal abnormality. Yeah. So it's really nature's way of protecting itself and not wanting to let a pregnancy that's abnormal go on to term. Usually, women less than age 30 are going to have about a 10% chance of miscarriage, okay? But with Mark Zuckerberg and his wife, they experienced 3 losses, and that happens in 1% of the population.
Wow.
Pretty rare, but we, of course, as a specialty clinic, see it a lot. And you know, what's interesting is that only 50% of the time we could determine why. The other 50% of the time, probably should talk about a little bit. If we could say that there are genetic causes, anatomic, something with the uterus, autoimmune, which is immunologic, and hormonal. So those are the things that we look at, and if we could find a reason, there's a good outcome.
When you hear something like this, 3 in a row like that, at what point do you say to a couple, okay, now we're getting into a dangerous area, what can we do differently? How can we sort of prevent this from happening again?
Excellent question. Once you do the evaluation, when a couple comes to see me, I usually say, hey, let's wait a minute. Don't continue trying to conceive, because you're able to get pregnant. The problem is that we can't sustain it. So let's do the full evaluation. And you know what's interesting? After you do the full evaluation, if it's unexplained, they have a good chance of conceiving with close monitoring. And another study shows that over 10 years, and you don't want to wait that long, of course, but over 10 years, about 70 to 80% of the time they're going to conceive. You know what? I really applaud Mark Zuckerberg and his wife for coming out to talk about the devastation, but you know, the interesting thing is that they didn't talk about it as they were going through it. It's a quiet hell.
Right.
It's so devastating for these patients to go through. When they get pregnant, with recurrent miscarriage, when they get pregnant, they don't feel comfortable throughout the entire pregnancy. Other patients are celebrating every single day, and they're walking on eggshells thinking they're going to lose it. So support system is vital for these patients. You know, comments that are made for these patients are, well, don't worry, you could have another one. You know, I think that's probably as insensitive as saying, well, you lost one parent, at least you have another one. I mean, you know, you have to go through the mourning process, because they are very vulnerable. They feel isolated, withdrawn. They do feel they did something wrong, and they need to grieve. And the support system needs to acknowledge that they had that loss and to go through that, because they could even have anniversary reactions, you know, the due date of that baby, and to relive that. So it's a terrible, terrible problem. Of all the things that I see, it's the most difficult psychological problem that we have.
I can't imagine. Dr. Trolice, for our viewers who would like to get in touch with you, if they would like help, how can they reach out to you?
Well, thank you. My website is myfertilitycare.com, and we have a lot of social media on theivfcenter.com.
All right, a lot of success stories with this guy, a lot. Thank you so much. Always a pleasure, Dr. Trolice. 8:28, John?